They call him Dr. Death. But once, Christopher Duntsch was hailed as a brilliant mind, a man entrusted with the most delicate of human machinery, and a surgeon poised to conquer the complexities of the human brain. So how does a man at the pinnacle of his profession descend into a nightmare, becoming synonymous with medical horror? This is the chilling tale of a neurosurgeon's descent into darkness.
He thought he was it. He told us he was the best doctor in Dallas. There was nobody better than him. He could do things nobody else could do. And he didn't like for you to ask questions. He liked to do all the talking.
For medical doctors, the Hippocratic Oath is an unbroken pledge to do no harm, to save lives and keep the ethics of the medical profession. But Dr. Christopher Duntsch seemed to have forgotten this oath, or maybe he plainly disregarded it, only if he knew this would lead to very devastating consequences. A patient of Dr. Duntsch, identified as Kelly Martin, was a promising 54-year-old woman known for her friendliness and zest for life. Kelly had given all her life to work and family, unbeknownst to her that a chronic back pain was slowly building up, putting her in severe pains. Desperate for a change, Kelly spent her days looking for medical attention, and her search landed her on Dr. Christopher Duntsch's table. Duntsch was a reputable neurosurgeon who had recently gained popularity in Dallas. His qualifications were notable, and that also made him very high in demand, even above some senior colleagues in the profession. With the promise of removing her back pain, Kelly was in high hopes as she agreed to do a spinal surgery. The fixed date finally arrived, and Kelly was a bit nervous and hopeful. She trusted that the procedure was going to give her a better life. However, the expected routine operation turned into a nightmare because while operating, Duntsch had cut off her vertebral artery, and this caused a very dangerous internal bleeding. But instead of dealing with this serious error immediately, the man went ahead in defiance, either oblivious or indifferent to the complexity of the matter. Many of the nurses in the operating room were already doubtful of Duntsch's capabilities, and they were horrified but couldn't do much to intervene. Sadly, Kelly wasn't able to regain consciousness since the surgery, so she was moved to the ICU. However, the deed had already been done, and sadly, she would pass away the next day, and her family were worse for it. They were disturbed not just by the tragic death of a beloved mother and wife, but also by the terrifying discovery that her death could have been prevented if Dr. Duntsch had exercised the skill and expertise associated with his profession. Soon after, a lot of folks started to question his credentials, if he really was who he said he was, and what the essence of the Hippocratic Oath he'd sworn was, because that surgery became a shocking example of his incompetence. Sadly, that wasn't the only tragedy he was involved in. Mary Efford was another of his victims. She was a primary school teacher looking forward to enjoying her retirement after a pretty long service, but she had severe back pain that had eaten into her spine. So she tried her hands on various treatments, but there was no recourse. She was then referred to Dr. Christopher Duntsch, a surgeon with a supposed reputation as clean as a church lamb. She had finally met her salvation. Or had she? Well, at first, her consultation with Duntsch looked promising because of the confidence he exuded and the thought-out plan he detailed for the surgery. At least that made her hopeful of the outcome. But little did she know that her hopes would turn out to be her worst nightmare. When the operation day finally came, as optimistic as she felt, Mary believed she was in the best hands possible. But things soon went south when Duntsch during surgery started making too many silly mistakes, like severing nerve roots or misplacing surgery screws inside her spine. To show the extent of his carelessness, he had left surgical hardware floating inside her body. And it's obvious what that was going to cause. On waking after the surgery, Mary was in such excruciating pain that she once described it as the most terrible type of pain she had ever experienced. For one, she wasn't able to walk, and her health was failing rapidly. Because of this, she had to undergo multiple corrective surgeries by other surgeons, who were terrified by the extent of the damage. According to them, the procedure was nothing other than butchery. Mary's health was damaged beyond repair. The once independent and active woman was now bedridden with permanent internal infractions, which greatly diminished her life. She had placed great faith in her doctor, but was betrayed in the most unfortunate way. You might wonder how a reputable surgeon like Dr. Christopher Duntsch committed such silly blunders in a profession so sacred as the one he professed. To get a bit of understanding, let's take a piece out of history and see how he came to be known as Dr. Death. Born in 1971 in Montana, Duntsch's first major ambition was college football. His father had been a standout player in Montana, and even though Duntsch wasn't the most naturally talented athlete, he was determined to follow in his father's footsteps, so he spent countless hours training on his own and played linebacker for his high school Memphis team. Duntsch ended up at Millsaps College in Mississippi on a financial aid package, but he wasn't satisfied. His goal was to transfer and play for a Division I team. By his sophomore year, he set his sights on the Colorado State Rams and managed to make the team as a walk-on player. When people said he wasn't good enough, he just outworked them and made it happen. Still, Duntsch left Colorado after a year and transferred to Memphis State University, now the University of Memphis. He had hoped to continue playing football, but his transfers had cost him his eligibility. It was at this point that he set his sights on a new goal: becoming a doctor. And not just any doctor, he aimed to be a neurosurgeon. So he started out at the University of Tennessee Health Science Center, where he studied for both a medical degree and PhD, which is an exceptional feat for a human. A high achiever, Duntsch earned his MD with distinction, securing a place in the top 12% of his class and membership in the elite Alpha Omega Alpha Medical Honor Society. He continued his medical education at the University of Tennessee, completing a standard 5-year neurosurgery residency preceded by a year of general surgery. His academic performance was impressive, and this brought him recognition as a bright mind with a promising future, a future that would be marred by gross negligence and ineptitude. As a bright student, Duntsch contributed to research work during his time in school. This further promoted his name as a talent in neurosurgery, or an emerging one at least. Midway through his residency, in 2005, Department Chair Dr. John Robertson appointed him director of the school's tissue bank. In this role, Duntsch oversaw 2 labs and was supplying tissue samples to researchers. His ability to secure funding was evident as he amassed over $3 million in grants for research projects he led or co-led. Immersed in research, he became interested in commercializing the groundbreaking stem cell discoveries of Russian scientists Valery Kukikov and Tatiana Ignatova. But around 2006, the first cracks in Duntsch's carefully constructed image began to appear. Kukikov had made significant breakthroughs, identifying stem cells in human brain tumors, a potential game changer for cancer drug development. His research also unveiled a method for producing stem cells from intervertebral discs outside the body, offering a promising alternative to human extraction. Duntsch filed patents for both discoveries, which led to the formation of 2 companies, Novostem Therapeutics and Discgenics. While Novostem struggled financially during the 2008 recession, Discgenics, which held the patent for the stem cell production method, enjoyed greater success. Curiously, the scientists' names were misspelled on the patent. Ignatova and Kukikov claimed to have been the driving force behind the lab work, while Duntsch was heavily focused on the money. He secured investments in Discgenics from prominent local spine surgeons, including his future mentor, Dr. Kevin Foley, and the department chair, Dr. Robertson. Foley would later oversee Duntsch's minimally invasive spine surgery, fellowship at the renowned Semmes Murphy Clinic. Amidst these achievements, however, Kukikov and Ignatova assert that Duntsch exaggerated his contributions to the scientific discoveries. It would seem that those exaggerations heavily impacted on how he was viewed later in his credentials. He'd always say he was the best doctor around. He'd tell you he had a plan, a way to sell it to you, and then a way to fix whatever was wrong. That's a lot to promise, especially for a neurosurgeon. Other doctors thought he talked too fast and was full of himself. They said he liked to be alone, but most people really liked him from the start anyway. It's just that he would say some weird stuff, like he was the only one who could do surgery without messing things up because everyone else was doing it wrong. That was probably because of his long list of awards and qualifications after completing his residency and fellowship that made him seem like a top-tier surgeon. After finishing his residency and fellowship, he joined Baylor Regional Medical Center at Plano as a minimally invasive spine surgeon. His salary was $600,000 a year, plus bonuses. Unfortunately, several of his surgeries at Baylor Plano went terribly wrong. Kenneth Fennell was the first patient Duntsch operated on at Baylor Plano, and he ended up with chronic pain because Duntsch operated on the wrong part of his back. Fennell had a second surgery by Duntsch to try to fix it, but this operation left him significantly paralyzed in his legs. Fennell needed months of rehab, and even after that, he couldn't walk more than 30 feet or stand for more than a few minutes.
Since my husband was the first patient at Baylor Hospital in Plano, and then shortly after that, Kelly Martin died, and then Jerry had that surgery, left him a quadriplegic. If they had done their job and stopped Dr. Duntsch then, instead of giving him a letter of recommendation to go to another surgery hospital, 80% of these patients wouldn't be in the shape they're in now.
When the hospital realized Duntsch wasn't meeting their care standards, they revoked his surgical privileges permanently. They started another review process, but Duntsch chose to resign rather than face certain dismissal. To avoid the costs and possible legal trouble of firing him, the hospital and Duntsch's lawyers worked out a deal. Duntsch was allowed to resign with a letter from the hospital stating there were no issues with his performance. If he had been fired, the hospital would have had to report him to the National Practitioner Databank.
They would rather not cause trouble for the doctor or potentially themselves. They'd rather just kick the can down the road, make the doctor become another hospital's problem.
When he relocated to Dallas to continue his practice, he started proclaiming himself as an expert in doing intricate spinal procedures, and surprisingly drew clients from all over the world. But beyond this professional facade was a sobering truth. Despite warning signs during his training, concerns raised by peers and mentors, Duntsch still managed to secure a position in the highly competitive field of neurosurgery. He had a knack for presenting himself as highly skilled, masking the serious flaws that would soon become tragically clear. And it was also evident in his personal life. In 2014, a former girlfriend of a close associate described a drug-fueled birthday celebration for him that took place during his residency. There was heavy alcohol consumption, cocaine use, and pill abuse everywhere throughout the night of the party. However, Duntsch had gotten to the hospital for rounds the following morning without any impairment. For most individuals, cocaine use typically induces paranoia and a desire to isolate and eventually lead to being incapable of functioning, especially after a night of such excess. Yet, he had seamlessly transitioned to his professional duties.
There is one report that he spent an entire night doing cocaine at a party, and then when the sun came up, put on his scrubs and went off to the hospital to treat children.
Dr. Frederick Boop, the neurosurgery department head in the University of Tennessee, Duntsch's residency institution, appeared to have had knowledge of Duntsch's substance abuse issues. Once during eventual investigations, it was said that an anonymous complaint saying Duntsch had used drugs before going into surgeries had been filed, and that the university had requested a drug test from Duntsch. But he had evaded them by absenting himself for several days. and when he showed up, he was mandated to participate in a program for impaired physicians and subjected to close monitoring during the remainder of his surgical training. That should have been a foreboding of what was going to happen in the future, but nobody paid serious attention. As more patients and colleagues now witnessed the results of his surgeries, the nickname Dr. Death began to spread. This name captured the horror and disbelief felt by patients, their families, and the medical community as they realized just how incompetent he was. Duntsch's gross negligence and reckless behavior in the operating room led to severe complications, permanent injuries, and deaths. Duntsch consistently engaged in dangerous surgical practices. He frequently ignored basic surgical principles, and this negligence led to dire consequences for his patients. The tragic outcomes included not only physical injuries, but also emotional and psychological trauma for the victims and their families. The large number of cases and the severity of the outcomes painted a picture of a surgeon who was either willfully negligent or deeply incapable. At first, colleagues thought he was a skilled and driven surgeon, at least for his readiness to take on challenging procedures and his seeming commitment to patient care. Along with his academic qualifications, he was also frequently seen as a physician who instilled hope and faith. But when the after effects of his procedures started to show, people's opinions of the man started to shift. When patients came to Duntsch, they were frequently at the end of their ropes. They had tried everything else and nothing worked. Duntsch came along and told them he had a plan, a really good plan. He made it sound like their life would be totally different after surgery. They were in so much pain, they thought he was their last hope. They really believed he could fix them and make all the pain go away. Duntsch was really good at talking. He painted the picture of that kind of life like everything would be perfect after surgery. People often felt like he was this amazing doctor who could do anything. They trusted him completely, but it all went wrong in the end. Duntsch was a terrible surgeon. It was clear from the start that he didn't know what he was doing. Even simple surgeries turned into disasters. He made so many mistakes, it was like he was trying to hurt people. The worst part is that people paid the price because of him. Take Philip Mayfield, for example. He was just looking for some relief from back pain. But after Duntsch operated on him on April 9th, 2013, he couldn't move. It was a simple surgery that should have taken about 45 minutes, but it ruined his life. Philip and his wife were terrified as they walked into the operating room, praying everything would be okay. But it wasn't. After entering the pre-operative area, Duntsch marked the incision site on Philip's collarbone with a black marker from his scrubs. He had assured the Mayfields that the procedure would take a maximum of 45 minutes. However, after an hour without updates, Angela began to feel anxious. 2 hours later, her worry escalated to terror as hospital staff failed to provide any concrete information. When Duntsch finally appeared in the waiting area at 1:30 p.m., he informed Angela that the surgery had been successful and she could see her husband. Rushing to the recovery room, Angela found Philip barely conscious, surrounded by seemingly distressed nurses. Philip was writhing in agony, demonstrating little control over his body, while the nurses urgently called for Dr. Duntsch. Transferred to another hospital hours later, Philip underwent a pinprick test that revealed paralysis up to his chest. An MRI confirmed the most devastating news. His spinal cord was severely damaged. The Mayfields were informed that this was permanent. Following 5 days in the ICU on steroids to reduce spinal cord swelling, they faced the grim reality of Philip's paralysis. They said that the damage to Philip's body was too extensive for any medical intervention. Because the injury was irreversible, it left Philip with life-altering consequences, and his ordeal would be a stark reminder of the catastrophic impact of Duntsch's negligence. Any surgeon would tell you it's heartbreaking when something goes wrong to a patient. And being a neurosurgeon is no joke. The path to becoming one is very tasking and requires commitment. Years of specialized training are necessary to develop the requisite knowledge and skills. That's why the journey necessitates significant personal sacrifices, as aspiring neurosurgeons often forego the typical experiences of their peers to focus on their studies. To achieve board certification, neurosurgeons often complete over 50,000 hours of training across 7 intensive years. But mastery of neurosurgery is a lifelong pursuit that demands continuous learning and adaptation. 2 things Christopher Duntsch wasn't willing to do. His surgical training was deficient. While most neurosurgery residents typically perform over 1,000 operations during their training, his experience was significantly limited, with fewer than 100 procedures under his belt. His residency was also marred by serious concerns about his fitness to practice. During his 4th year, there were suspicions that he was using under the influence of cocaine, and as a result, he was mandated to attend a rehabilitation program for impaired physicians. After several months, he was allowed to return to his residency. Multiple friends have described instances of Duntsch reporting to work after nights of drug use, with one flatly stating they would never trust him to perform surgery. Sadly, the tragic case of Floella Brown exemplifies the devastating consequence of that. At Dallas Medical Center and undergoing surgery to address neck issues, Floella Brown's vertebral artery was cut, and it resulted in a stroke. But despite the medical care she received after the surgery, she succumbed to her injuries, leaving her family devastated. He lasted less than a week in the hospital before administrators revoked his privileges following her death. These were not isolated incidents. Jerry Summers wasn't like every other patient. Their relationship extended far beyond the doctor-patient dynamic. They were close friends and former colleagues who shared a deep bond forged through years of shared experiences. Given their history, it was only natural for Jerry to seek treatment from Duntsch when he developed a minor neck issue. Reassured by Duntsch's confident assertion that a spinal surgery would alleviate his pain, he placed his trust in his friend. But unfortunately, this misplaced confidence would have devastating consequences. As you'd expect, the operation was another nightmarish procedure. During the surgery, he had made more terrible mistakes by severing several critical nerves that damaged Jerry's spinal cord. The consequence of this was deep because Jerry would never have to walk again. Jerry's lower body became paralyzed. The man was now confined to a wheelchair. His freedom was stolen in a twinkle of an eye. Jerry's case then became a transforming moment that uncovered Dr. Duntsch's career. As more individuals suffered injuries, the public and medical community became increasingly aware of the extent of his misconduct. Duntsch's reputation began to shrink when an increasing number of patients started to claim severe side effects and irreversibly damaged bodies following their treatment. His abilities started to be questioned. It was becoming more difficult to ignore the mounting proof of his incompetence. After his surgical mistakes were extensively publicized, the media picked up on the story and started calling him Dr. Death. It became clear that his errors were not isolated incidents, but a consistent pattern of negligence and disregard for patient safety. Duntsch frequently deviated from accepted medical procedures and made patients suffer paralysis, chronic pain, and even death as a result of his botched surgeries. He also lacked skills and knowledge of surgical techniques and spinal anatomy. But particularly alarming was the number of individuals left permanently disabled. At least 30 people were crippled by his surgical errors. That was what forced the hand of the medical community. They were faced with the reality that such an incompetent individual had been allowed to practice for so long. In one procedure, Duntsch put screws in the wrong position that were supposed to support the spine. Instead, he drove the screws into the muscles and nerves. This error resulted in excruciating agony and further difficulties for the patient, who had come for treatment of persistent back problems. In another case, he screwed a pin into a patient's spinal canal, severely damaging the nerves and paralyzing the patient. During a surgery on one Jacqueline Troy, he caused severe damage to her vocal cords, trachea, and an artery. Troy was left with limited ability to speak and required sedation for weeks and tube feeding due to food entering her lungs. Despite these complications, Duntsch remained employed at the hospitals he worked under new ownership. They failed to report him to the medical board. Later, while operating on Jeff Glidewell, Duntsch made another error, mistaking a neck muscle for a tumor. He severed Glidewell's vocal cord, damaged his esophagus, and cut an artery. To control the bleeding, Duntsch packed a surgical sponge into Glidewell's throat and closed the incision. This led to a severe infection. When other doctors discovered the sponge, Duntsch refused to return to the operating room. Then veteran vascular surgeon Dr. Randall Kirby was called in to correct Duntsch's mistakes and described the surgical site as the work of a crazed maniac. Kirby believed Duntsch had attempted to kill Glidewell because the man had suffered permanent damage to his vocal cord and esophagus, as well as partial paralysis. The effects of Duntsch's botched surgery continued for years and required over 50 corrective procedures. After the Glidewell case, University General Hospital, where Duntsch worked, terminated his employment. These were only examples of Duntsch's disdain for accepted surgical practices. He once placed a plate in the wrong place during surgery, pressing it up against the patient's spinal cord. This mistake resulted in prolonged discomfort and significant nerve damage, requiring several procedures to fix the original problem. The true extent of Duntsch's malpractice was often laid bare during corrective surgeries performed by competent surgeons. These medical professionals were horrified by what they found, and they described Duntsch's work as more like butchery than surgery. On one occasion, Duntsch had left a surgical sponge inside a patient. This careless oversight could have led to severe infection and required additional surgeries. The patient endured excruciating pain and a prolonged hospital stay as doctors worked to remove the foreign object and treat the resulting infection. For patients like the Mayfields, Philip was left crippled. His body required multiple corrective surgeries that could never fully undo the damage, so he channeled his energy into a grueling recovery process. Released from the hospital in 2013, he dedicated himself to rehabilitation, progressing from wheelchair to walker to cane. Paralysis gripped his entire right side and left arm, while weakness plagued all four limbs. His suffering was compounded by the development of syringomyelia in 2014, a condition causing painful fluid-filled cysts on the spinal cord. But perhaps the most tormenting aspect of Philip's ordeal was complex regional pain syndrome. One time, he described the agony as being doused in gasoline and set ablaze. His skin blistered and peeled, and his ordeal had taken quite a toll on his entire family. His wife, Angela, lived in constant fear of his unpredictable fainting spells, which struck without warning. One time, she recalled one terrifying night when he collapsed while getting up to use the bathroom. Sadly, he died in 2021 from COVID. Lee Passmore, another victim in November 2011, was dependent on prescription opiates to numb the pain shooting from his lower back down his legs. He hoped surgery could help him stop the drugs and fix his problems. His pain management specialist advised against surgery, but gave him Duntsch's card. Passmore booked surgery, and then Duntsch operated. Duntsch worked with Mark Hoyle, a general surgeon then, who made a small cut above Passmore's groin on December 30th, 2011. Hoyle had moved the blood vessels and organs aside to give Duntsch clear access to the lower spine to remove a herniated disc that was pressing on a nerve and causing pain. But while Duntsch was operating, Hoyle noticed blood everywhere, but not much else. The blood was pouring out of the epidural blood vessels and collecting in the disc space. Duntsch continued as if he were fishing in the dark, claiming he was working by feel, not sight. He then said he would remove the posterior longitudinal ligament, a crucial spine stabilizer close to the spinal canal. Hoyle was furious and told him that they needed to talk. It was only then that Duntsch backed off and allowed Hoyle to stop the bleeding and clean out the wound. The surgery continued, and Duntsch placed a surgical cage where the disc had been to widen the space around the nerve roots and relieve pressure. However, Hoyle later saw on an X-ray that the cage was positioned too far to the left. When Duntsch tried to adjust it, he stripped a screw, so the cage stayed in the wrong place. After a whole lot of injuries and complaints, Dr. Kirby submitted a detailed complaint to the Texas Medical Board, characterizing Duntsch as a sociopath who posed a danger to the public. And it wasn't until June 26, 2013, that the board identified the pattern of patient injury necessary to justify suspending Duntsch's license. After that, several lawsuits followed. Several of Duntsch's victims and their families filed lawsuits against him and the hospitals where he operated. Interestingly, Mary Afford sued Baylor Plano Hospital, the hospital where Duntsch has operated, on her claiming that the facility knew he was incapable of performing her surgery and still granted him privileges. Her story attracted a lot of attention from the media. The legal action taken by Kelly Martin's family also helped raise awareness of the structural problems with the healthcare system. Duntsch's employers were eventually criticized for not reporting him, with the argument that his desire to continue operating was driven by the lucrative salary of a neurosurgeon, which could alleviate his mounting financial problems. Despite objections from Duntsch's lawyers, prosecutors called several of his other patients to testify to demonstrate that his actions were intentional. His lawyers claimed that he was unaware of his poor performance as a surgeon until they heard the prosecution experts outline his numerous operating room errors. The defense said Duntsch's actions were due to the inadequate training and lack of oversight by the hospitals. Now, the 4 hospitals that employed Duntsch still continue to have ongoing civil cases against him. He was charged with a number of crimes related to his disastrous surgical procedures, and the charge pertaining to harm to an old person was the most serious. Duntsch was convicted of a first-degree felony in Texas for willfully, deliberately, and carelessly causing significant physical injury to an old person. And after 13 days of trial, the jury took just 4 hours to convict Duntsch for the maiming of Efford. On February 20th, 2017, he was sentenced to life in prison. Then, on December 10th, 2018, the Texas Court of Appeals upheld Duntsch's conviction by a 2-1 split decision. And finally, on May 8th, 2019, the Texas Court of Criminal Appeals denied Duntsch's petition for discretionary review. As of now, Duntsch is incarcerated at the O.B. Ellis unit outside Huntsville. Even with credit for time served in the Dallas County Jail before trial, he is not eligible for parole until July 2045, when he will be over 74 years old. Duntsch's conviction was not just a legal victory, but a big step towards addressing some systemic issues and preventing similar tragedies in the future. It's believed to be the first instance in U.S. history where a physician was convicted on criminal charges related to their medical practice. His actions were a result from critical breakdown in the safeguards designed to protect patients from medical harm. Despite numerous red flags and warnings raised by colleagues and medical staff, he continued practicing, resulting in a devastating toll on his patients. The relationship between a patient and a doctor is built on trust. Patients put their lives and health in the hands of medical experts because they trust them to provide them with skilled and caring care. The premise that physicians uphold the highest moral standards and are dedicated to the do no harm precept of the Hippocratic Oath underpins this confidence. The ramifications are severe for both the individual patients and the larger medical community when this confidence is betrayed. Dr. Death, in all his inhuman surgical procedures and crude methods, is only a scratch on the surface of the many nefarious practices in medical institutions going on unnoticed. If you enjoyed this video, kindly give it a like and click on subscribe. Bye for now.